Hi, I'm Dr. Corey Moss, and we're here today to talk about the Moss and Warren skincare line, which has been in existence for almost 10 years now, but was very recently refined with the help of an associate in dermatology that has brought it to a new level. We're excited to be launching this new program based on a series of basic conditions that we felt were critical, and Dr. Warren was an integral part of getting us to this finish line. And we're still evolving, so I call it the finish line. It's really the beginning. And with that said, there were a few things that we wanted to go for, and I wanted to make sure that we got to those in just a few minutes. But first, a little bit about Dr. Warren. I'd like to introduce my colleague and friend, Dr. Scott Warren, who is a dermatologic surgeon. Scott, can you tell us a little bit about yourself? What brought you here?
Well, I've been in practice for over 29 years, double board certified in micrographic dermatologic surgery and dermatology. And through the years, seeing people's skin issues, I knew it was important to have a good skincare product line. And it's difficult to put the right different products together to achieve a certain goal. And looking at your line that you had started 10 years ago, it was filling that need. And with a few modifications, I think we've come to a very good product line.
So I should qualify that I started my practice in head and neck surgery and did fellowship training in facial plastic surgery. So you've got a nice combination of the plastic surgery component, and just pretty much limit my practice to aesthetics now. And with that in mind, stepping out to get a dermatologist perspective and input from the science, which I think really is the key part of this. And I know that Dr. Warren will agree, but over 80 or 90% of the dollars that are spent now on skincare products are spent on marketing and packaging the products, not on the science. So we really worked to identify molecules that not only are meaningful, but are based solely on the science of efficacy, which means how well it works, of course. And with that said, there really are only a handful of them that have a lot of science behind that, and we'll get into that in just a couple minutes. But we also came up with some other criteria, which we both know as physicians, that are critical. And one of the things about medicines in general is if you don't use them, they won't work. So we know that if people have to use something more than twice a day, their compliance or ability to use that successfully goes down dramatically. It drops below 50%, number one. Number two, we know that if you have to put a complicated set of a series of different products on your skin, which many people have a whole lineup on their countertops, the complications make it difficult for people to be compliant with using them. So it had to be simple and it had to be effective. And those two principles were the main things that were driving us. And so we, in putting our heads together, we took our backgrounds and experience and came up with a product line that is easy to use, that you do twice a day, just like you're brushing your teeth. And so we sort of pitch this way for all of our patients, because for both of us, people come in and they want to look their best. And if you're not on a good skincare program, I think you're really wasting a great opportunity. So we want to make sure everybody that comes to our office is using the skincare. And historically, it meant very little to either of us whether we were selling a lot of this, but we wanted to make sure that every one of our patients were on it. And now we're trying to expand the scope of this and make sure it's available to others. A lot of that's at the behest of our patients, I would say, too.
Right.
The last part was, I said it in three areas, that it's simple and easy to use, that it has to work, and that's the other part. But we also want to make sure that when people use it, they get a sense that their skin is improving. And we are working, we've done several studies, but the one that we're in the middle of, a controlled, clinically controlled clinical trial, the science trial, where we look at a group with placebo or their own skincare products and then our own, is already showing a spread or a disparity between home skincare products and the use of the Maas and Warren skincare line. So what do you think differentiates the two from the average patient that you have?
Right. Well, I absolutely, we came to the agreement that it has to be simple, because we've known for many years about acne patients who use skincare products to treat acne. And if you get more than a few products out there, they just don't use it. And when they don't use it, they don't get better. The other thing is they have to use it long enough to where they begin to see improvement. And it doesn't just happen overnight. You know, it's going to take a few months before they really see improvement. And then they'll continue to use the products just like they do with the acne field. And also the patients over the years that I've seen that come in with the skin cancer, and you just keep treating and treating and treating, and they keep having, trying to protect their skin from sun damage. But what we wanted to do was make it to where they had some rejuvenation of that skin, to where they were having less issue in combination with the protective part, and where they would just improve and not have as many issues with the skin cancer and the precancerous lesions.
Yeah, so Dr. Warren sees skin cancer patients every day and has treated, I guess, tens of thousands, hundreds of thousands?
Yeah, well.
Treatment numbers.
Yes, at the 100,000 range, yes.
Yeah, so this is a common denominator, that it goes beyond just beauty and it gets into the function of these things. And so with that in mind, and we talked about the big umbrella, the sort of pillars of the skincare, there were very specific areas where we felt this is where we want to make sure we're touching on it. The first of them is that we need something to cleanse and or exfoliate. Exfoliating means taking the outer layers, gently taking some of the outer layers of the stratum corneum of the skin away, which helps to stimulate remodeling and renewal of the architecture of the skin. The second part is to treat the skin, like we were just talking about, and we know by far the two molecules that have the best science behind them are the tretinoin molecule, which is, there's a couple of trade names that are covered under that, but it's in the retinol category of products. Specifically, the one that everybody's heard the name brand of is Retin-A, which is no longer on patent, but tretinoin is the actual molecular name of that product. Retinol and Retin-A are very similar in that retinol has to be converted to Retin-A in the skin, so it takes a little bit longer to tretinoin in the skin. But in the end, those molecules, along with L-ascorbic acid, are the two molecules that we know the most about. There's a handful of other molecules that we put in there that there's a growing amount of science which are primarily antioxidants. And so if you look at it, it's sort of cleanse and exfoliate, treat the skin. One of these is used in the morning, one at night. And then the fourth part, which Dr. Warren is one of the true experts in this area, is protecting the skin, and that's in the form of sunscreen. And it's not sunscreen as you necessarily would traditionally think about it. We have sunscreens that you can brush on as a powder. We have sunscreens you can spray on. We have sunscreens that you can apply as a lotion. But the idea with sunscreens, and I'll let him tell you because he knows more than I do about it, if you don't apply them frequently, they're not going to work. Sunscreens when you're out sweating and wiping your face down when you're out swimming and sweating or playing sports really are going to only last a few hours at the most, probably a couple hours, especially if you're in the water. So they have to be frequently reapplied. I don't know what, I'd probably ask you how accurate is the waterproof claim of sunscreens?
Well, the whole difficulty with sunscreen is all the different SPFs you have. So people ask, why do I need a SPF of 30 or 50 if, it's going to take me 30 hours or 15 hours in the sun to get, red if I'm using this sunscreen? Well, the problem that most people have is they don't put enough on.
Mm-hmm.
When they do the testing, it's usually a lot more than they end up putting on their skin. And so that SPF of 30 now drops to 7 because they use about a third of what they need. There's also the problem with, reapplication if you are in the sun. And even though something can be waterproof or water resistant, that doesn't mean that it absolutely will stay on your skin and not change and not come off, and you won't get burned. So most everyone has been out all day after applying sunscreen and then come in the house and say, oh my gosh, I got burned. I put my sunscreen on. But the problem is they didn't reapply. So you want, some idea of how often you need to reapply, which depending on your activity or the water, could be an hour, could be, 2 hours. And again, on the SPF. But there are products that do feel better on your skin than others. And we wanted something that people would put on their skin. It would stay on there, but it wouldn't have that tacky or oily feel.
Mm-hmm.
And I think we've come up with some really great products for that.